I'm Beverly Kirk here with Nellie Bristol. She's a research fellow with the CSIS Global Health Policy Center, which has just released a new report on global health policy in the second Obama term. And today we're talking about polio eradication. It's one of the 7 policy areas that was analyzed in this report. And thank you for being here.
Sure.
First and foremost, where are we on the path to polio eradication, and how do we get here?
Well, the program started in 1988, and at that point there were more than 350,000 cases of polio estimated worldwide. And this last year, in 2012, there were only 222, so it's at the lowest level ever. And it's been a hard fight. There was a good drop initially with the program, but then it kind of stalled out through the first decade of the 2000s. And but then there's been some good progress recently with the polio elimination in India as of January 2011, and some good progress in some of the other countries.
The U.S. is a major contributor to the Global Polio Eradication Initiative, which is now putting together a new strategy. What is that strategy and how is it supposed to work?
It's a 6-year strategy that goes through 2013 to 2018. And it, the first and foremost goal is to get rid of transmission of polio. There are only 3 countries where polio is still endemic, which means they've never stopped transmission in those countries: Afghanistan, Pakistan, and Nigeria. And they've proven to be quite difficult, and but there have been some new resources and some new tactics that seem to be working there, although there's also some sort of chronic violence that is going on there, so they have to deal with that as well. So they've got insecurity and political problems that they're dealing with there. And so it remains a challenge, but but the program actually had its most successful year ever last year, and they're trying to keep the momentum going. So this strategy, the first point is to get rid of polio transmission in the remaining countries, and to integrate better polio eradication with routine immunization in some countries, because they have to switch over from one type of vaccine to another. They use an oral polio vaccine now, and they have to switch to an inactivated polio vaccine, because in very rare cases the oral polio vaccine can cause paralysis itself. So so to really get rid of polio, they have to make the transition to the different vaccine.
And you mentioned those 3 countries. Would you say they're the toughest nuts to crack right now in terms of getting the polio numbers turned in the other direction?
Right, to getting rid of polio. Yep. So so there's intensified efforts in those countries, and there's a lot of work to try to reach out more to the local communities there, and to educate them about the positives of vaccines. There's some mistrust that goes on in some of these communities. So and there's going to be a vaccine summit later this year in April in Abu Dhabi, and they're trying to pull in the Muslim community a little more into some of these activities too.
There are a lot of recommendations in the report, and among the recommendations is this call to put the eradication end-game strategy first.
Right.
Can you tell me what that means?
Yeah, well, that means because there are 4 points to this strategy. The first one is getting rid of polio transmission. The second is this immunization, routine immunization. The third is containment of poliovirus in laboratory and facility situations. And the fourth is a legacy planning process. Well, they'll catalog all the resources and all the tools that they've developed through the 24 years of this program, and figure out how they can apply them to other programs. So we want to make sure that the focus stays on eradicating polio, as opposed to some of these other aspects, that the number 1 goal is polio eradication.